Well, welcome everybody. My name is Brenda Graylish, and I'm the Executive Officer for the Council on Criminal Justice and Behavioral Health. And I'm really happy to welcome everybody today for our very special Lunch and Learn webinar on suicide prevention and crisis services, with it being Suicide Prevention Awareness Month and in particular week here at CCJBH. We're looking to put out a lot of resources and just get out the latest and greatest information that we have access to, just to try to circulate knowledge, especially as so many people are working to build out the 988 crisis services and really crisis system in our state. There's so many amazing investments underway right now, and now is the time to just get as many voices to the table as possible to get the great thinking going, to really build out and strengthen our system. As our state went live with 988 back in July, it's really exciting to have WellSpace here with us to give us a little intel on what's happening with that implementation. WellSpace and several others have been long-standing folks doing crisis services here in our state of California, definitely with the National Suicide Prevention Lifeline, which is what has switched over to 988 nationally and here locally. So really excited to have Lisanne Wick here from WellSpace to really share with us kind of from the boots on the ground what is happening and where we're going. And for all of you who are taking time out of your busy schedules to join us and hear this information, and I know so many of you are going to be working in this space, a big thank you for taking the time to be here with us, to be thinking about all of this, especially as it relates to the individuals with behavioral health needs who are involved in the justice system. And that's really where we want to do, where we focus our work here at CCJBH, and particularly the upstream. And a lot of times, folks enter into the justice system through crises, and so really being able to kind of flip the script or do things a lot differently and build out that front end system so that we can see the impact with decreases on the prevalence rates of individuals with behavioral health needs in jails and prisons. And for those of you who have tuned into CCJBH meetings before, or have looked at our legislative reports, you'll see that's one of our primary goals is to see the reduction in individuals with behavioral health conditions who are in jail or prison. And so really want to see that number go down. And a big way to do that is through this crisis system opportunity, and really as our state's building out that crisis continuum of care to wrap around people and provide supports early on and even preventing crises at all. So with that, I will speak no more and pass it along to my assistant, Monica Campos, who will take us through a little bit of housekeeping and run through the agenda, and then turn it over to, without further ado, to our presenter today. And thank you so much, Lisanne, for joining us so that we can learn from you and see where our state and our systems are headed. So with that, Monica, if you could just give us a little background.
Absolutely. Good afternoon, everybody. Quickly, I would like to go over the agenda and also just a few housekeeping items. So here we have our agenda. We will have a presentation today on suicide prevention and crisis services. And we'll have a session for Q&A after the presentation. Shortly after Q&A, we'll do some announcements, and then we will close out our Lunch and Learn for today. As part of a housekeeping, know that you will have the ability to ask questions at the end during the Q&A session. We ask that you use the raise hand feature here in Zoom. You will be placed in the order that you click that button, and someone here at CCJBH will unmute you when it's your time. We'll announce your name, and that's kind of the cue for you to unmute yourself, because you'll have that ability, and then you'll be able to ask your question. If for whatever reason you're unable to, participate live and you have a question that you'd like to ask, we also encourage you to send it to our email address at ccjbh@cdcr.ca.gov. One of the things we like to go over is webinar policies here at CCJBH. Participation, we welcome your participation. Please note that disruptive behaviors is not aligned with the purpose of this session, and it will not be tolerated. Any individuals disrupting the webinar today will be removed without warning, and in the event of a security incident, this session will end immediately, will not resume, and we will send out an email, a separate email to everybody that has registered today for further instruction. In addition, commentary, participants' comments in the Q&A do not reflect the views or policies of the presenter, the Council on Criminal Justice and Behavioral Health, the California Department of Corrections and Rehabilitation, or its affiliates or contractors. By using the Q&A, you agree to keep comments relevant to the topic of today. While a variety of diverse perspectives and opinions are welcome, disruptive comments are not, and they do not align with the purpose of today's webinar. And users creating disruption, again, as mentioned, will be removed without warning. I will now like to turn it over and introduce Ms. Lisanne Wick, Director for Suicide Prevention Services at WellSpace. And I would like to turn it over to her. Welcome, Ms. Wick.
Great, thanks so much for having me. Really appreciate it. As my wonderful hosts mentioned, I'm from WellSpace Health, and if you're not familiar with WellSpace Health, I'll tell you a little bit about it before we dive into suicide prevention. Go ahead, next slide. Our mission is achieving regional health through high quality comprehensive care, and that includes our suicide prevention program, as I remind my staff all the time. Go ahead. We really do believe that everyone deserves to be seen, no matter who you are, where you come from, where you work, or what place you call home. Next slide. Today, I'm going to talk a little bit about 988, the new number to reach the suicide prevention and crisis line. It's part of the National Lifeline Network that we've been serving for decades now. The crisis centers here in California and nationally. And then I'll also talk a little bit about suicide prevention, just general suicide data and outcomes, and maybe some Q&A at the very end. Next slide. This is Suicide Prevention Week, and it's always, for me, it's always a bittersweet thing, because I love to share about the work that we do, but it also is a reminder of the painful side of the work that we do, and all the deaths that are behind that, and all those suicide attempts, and all the lives that those attempts and deaths touch. And this year has come really close to me, professionally, but also personally, and so I'm even more, aware of just the impact that our work has, on a daily basis. Each year in the United States, over 47,000 people die by suicide. That's one person every 11 minutes, and one suicide attempt every 26 seconds. That's stunning to me to even think about, in the course of the time that we sit here. You can just imagine how many suicide attempts that would be happening nationally just while we're sitting in our chairs having lunch and meeting together. For each of those suicide deaths or even attempts, there's an estimated 25 people or more that are intimately connected with that human. And so they have a lot of trauma, as you can understand, as a survivor of suicide loss. And the impact is higher. The impact of that trauma puts them at a higher risk of suicide in the future. Not everybody goes on to attempt their life after that experience, but some do. And that trauma is lifelong. The rate for suicide nationally is 13, almost 14 per 100,000 in population. And California is slightly below that at 11.2 per 100,000 in population. That's pretty standard year to year. Occasionally we'll go slightly above the national rate, but we're usually hovering either just above or just below, not dramatically different than the US rates. Suicide does rank 10th leading cause of death overall. That's consistent almost every year in the US, and likewise for the state. And suicide is the second leading cause of death, though, for 15 to 24-year-olds. So that's really striking. If you think about it too, it's even more striking because our youth aren't supposed to be dying that early, much less by their own hands. But that said, middle-aged, especially middle-aged white males, but middle-aged ages 45 to 64 have the highest rates of suicide of all the age groups in the US. As far as gender goes, there's definitely a difference. Males represent 78% of suicide deaths, where females are 22%. Some think that's because men tend to choose more lethal means. I'd probably agree with that. There's nothing that says otherwise. And at least 50% of suicide deaths are by firearms. And, they're just statistically are more men with guns than women. And easy access to means is one of the biggest risk factors when it comes to suicide. But the great news is there's hope. The 988 Lifeline helps thousands of people that are struggling overcome suicidal crisis or mental health related emotional distress every day. We have the privilege of saving lives every day, and that's the sweet part of my bittersweet feelings about Suicide Awareness Week, is that for 18 years now, I've had the privilege of doing this work, and I'm reminded on a daily basis, how powerful that is. Multiple times today, we have life-changing calls, life-saving calls. The vast majority of, I'll do a little myth busting. The vast majority of our phone calls do not result in an emergency rescue intervention. Less than 1.5% end up in a 911 call. So despite some of the social media slams you might see out there, we don't like to, nor do we, call 911 on a regular basis. We treat everybody anonymously if they want to be anonymous. Your call is confidential, short of a life-threatening emergency. And usually when it comes to the point of us having to call for an intervention, it's because somebody's already done something to end their life. And at that point, there's a mandate. We don't have a choice. But the vast majority, the other 99% or 99.5% of those calls, we get to work with the person and talk them down. And so I'll tell you a little bit more about that when we get onto some of the upcoming slides. Go ahead. So WellSpace has had over 53 years of providing the suicide prevention crisis line in Sacramento, in Placer County, the 6 Forest Hill Bridge calls, or 6 Forest Hill Bridge phones, as well as the National Lifeline. We're nationally accredited by 3 different agencies. We have our Sacramento-based crisis line chat and texting available. And then we also, through the National Lifeline, cover 50 out of 58 counties, either primary or backup for the Lifeline. And we're serving now for 988 with a new launch as a national backup center for both the hotline for 988 hotline callers, as well as crisis chat and text users that reach out to 988 through those platforms. And that's great honor. We've seen some really amazing things happen so far since our launch. And then you can see the links to, if you want to help us promote, either to our local text program, you can text the word HOPE to 916-668-I-CAN, or go to suicideprevention.wellspacehealth.org. And that gets you to our Sacramento-based chat, text, and hotline. Go ahead. So I love that we have a great audience today, because each one of you is really vital in helping us promote 988, the chat and text services, helping to dispel some of the myths that are out there about what happens when you call the hotline and what can we do or what do we not do. And just, raising the awareness overall that the resources there, it's free, it's confidential. It helps people in a way that really nothing else does. People, because of the topic and the nature of suicide, there's still so much stigma around suicide and mental illness that people are afraid to talk about it. Many cultures still don't even have a word for it. It's still taboo to talk about mental illness in many cultures. And so if somebody is wanting to talk about it and they call the hotline, we see that as sacred ground. It's, a privilege to have that conversation, and we don't take that lightly. And so the more people that you can get the word out to, then the better chance we have of preventing those 47,000 lives. I'd love to see that number go down over time instead of slowly going up. I'd love to see a dramatic decrease in that rate. And the only way that we can do that is with everybody helping to promote the line, work on preventative services and access to those services. And part of that is what 988 is going to be offering. So I'll tell you a little bit about that here. You yourself can call the 988 hotline anytime, 24/7. We're here, holiday weekends and all. And then you can also call about somebody else, like a third party that you're concerned about. It could be a client, a friend, a family member, or a stranger on Facebook. We're here to help, whether it's a direct, intervention or helping indirectly to support you if you're struggling with how to help this person, as well as to help the person that you're worried about. You can offer the hotline number to others who are in a mental health crisis or a suicidal crisis. It's not necessarily a chat line. You don't have to be suicidal to call, though. So I want to be really clear about that. But it's definitely not like a warm line. I talked about third-party interventions. That's when you're calling about somebody else who's suicidal. After we educate you on as the caller who's in crisis about what to do, we'll let you know what your options as a helper are. Then we'll also offer to do we call it a third-party intervention, where if you want to give us the name and the phone number of the person who is talking about killing themselves that day, we'd be happy to do a phone call to that person. And that's up to you. If you feel like there's really a threat and you want us to do that, we're happy to do that. That call to them is confidential, just like your call to us is confidential. For life-threatening emergency situations, though, where somebody's already done something to end their life, or they're, literally standing on a bridge or holding a gun, you still need to call 911. Those are definitely life-threatening or medical emergencies, and we want to make sure that the correct resource is used for those. And in that case, you'd ask for a welfare check with whatever your local law enforcement jurisdiction is, and then they get the appropriate help out to the person in a really timely way. Next slide. So when somebody reaches out to us, whether it's through chat, text, or phone calls, we do a brief risk assessment. We ask about thoughts of suicide right up front. We want to make sure with each call that we know what level of safety is there or not before we dive into all their reasons for dying and the emotional pain and distress they're experiencing. And after the risk assessment, we might ask their first name just for conversation, what city or county they're calling from. That's for resources at the end, and just to understand who we're serving. We might ask about age. Again, that's part of risk assessment. And then it also helps us understand who we're reaching and who we're not. But then we move on and we do a lot of listening and provide a lot of empathy, explore their feelings, explore their reasons for wanting to die or live if they're feeling suicidal. We talk about that quite a bit. because usually when somebody's feeling suicidal, they've been holding it all in. They haven't been talking about it much, or the people they've tried to talk about it aren't comfortable hearing it or able to hear it or understanding. It's a scary thing to hear, especially from somebody that you love. And it's really kind of a natural response for us to go, oh, you don't want to do that. It's almost like a knee-jerk response that you have. But when we do that, we kind of close the door of communication. So we spend a lot of time exploring their feelings and their thoughts about suicide and reasons for dying. And we explore options for what might help now while they're feeling so bad. We talk about resources that could be helpful to them, what resources they already have existing, and how they feel about those, and what do they think might help them get through the next 24 hours. Because most of our contacts really are one contact, or maybe one contact and a follow-up call. So we want to make sure we get as much into this first call as we can. Our counselors talk with individuals, whether on chat or hotlines, about coping skills. We might explore apps for mental health, like mindfulness apps, or those. Sometimes a lot of our callers have challenges with sleep or insomnia for various reasons, and so we might talk about some of those that have sleep talk downs. Or depression. There are apps that even have a little cognitive behavioral therapy woven into them. I think like Wobot is one of them. I'm not pitching Wobot necessarily, but like Calm or Headspace or some of our caller favorites. And we might explore other informal resources, like a pet, or things that bring them a little bit of hope or a little bit of emotional relief when they're struggling and stressed out and feeling down and hopeless. And then, of course, we provide links to resources that'll help them face to face as they move on with their life after the call, because that's how it's designed to be, in suicide prevention. One of the great things about 988 is, as this first year is building infrastructures, building up all the crisis centers even more than they already are, to handle the increased volume that we're already seeing. And, my center is no different than many across the state. We've had a large influx of new staff, and we're training all that staff. So that's part of year one. And at the same time, counties throughout California and nationwide in each state are creating mobile crisis teams where they don't exist, or crisis stabilizations, or expanding those services where they do exist and making them 24/7. I can tell you in California, there aren't very many that are 24/7. We have a lot, not a lot, but we have several that are Monday through Friday and during the daytime. But it'll probably be like year 2 or 3 before we start making warm transfers to mobile crisis teams. But we already do that. Not the transfer part. We already talk about mobile crisis teams and crisis respite centers. In Sacramento, as an example, we would also talk about the mental health urgent care clinic. We talk about county resources when those apply. And we talk about people's private insurance resources. If they have private insurance, we have callers, from all over, all types of people, from college professors that are employed and have great insurance, to homeless individuals that have nothing and not even a driver's license, and help them figure out the system and help them navigate it to get their needs met in a really short time frame. We also offer a follow-up call. We found clinically that the value of a follow-up call is just as priceless as that first call, that first intervention. Sometimes people are still feeling suicidal the next day. They may feel better, they may feel relief, and they're really grateful for talking and for the resources, but they might still be having those thoughts the next day. So we'll still offer them follow-up calls until things have stabilized. It's just part of what we do. And that's, again, for anybody who's having current thoughts of suicide. It's also for anyone who's just experienced a suicide loss. We have most centers aren't, I know ours and the center at D.D. Hirsch in Los Angeles, we have a 30-day follow-up program for survivors of suicide loss, and it's free and confidential. It's part of what we do. Not just because of the emotional need, but also that, those individuals also carry an increased risk of suicide. And so anything we can do to provide the emotional support as well as resources is really going to help that individual and their family out. And as I mentioned, when people contact us, whether through calls, chats, or texts, we really don't love to call law enforcement. We have great colleagues at the law enforcement and first responders, but we really only want to bring them in when it's absolutely necessary, and that's definitely less than 1.5%. And the beauty of it is all this great intervention and prevention work happens right where people are, in their car, on their cell phone, and they could be texting us during classes. I have so many stories of students texting us, from a bathroom or a bench out on a playground at a school, where maybe they went to the office, but then they were afraid to talk and they started crying, and then they, went back out, or maybe the counselor was busy and they're very suicidal, and they start texting us or chatting with us through their cell phones, or sometimes call us. Same thing with college students. We have college students, contacting us, oftentimes from their from dorm rooms or their apartments. It can be really isolating for college students in general. When they go away, especially if they're going away from another town, or if they're separating from their parents, there's this autonomy, that's a normal developmental thing. They want to be grown up and be independent and on their own, but at the same time, they're in this new environment, lots of pressure, lots of responsibility, and all their supports are gone or not so easily accessible. So, and oftentimes there's a big culture shock where maybe they were the big man or girl on campus in their small town school, and then they go to some giant university where they're an invisible fish in the giant ocean, and they feel insignificant and like their life doesn't matter, and depression can really sneak in there. Next slide. The best way to reach us, of course, is just dial 988, 3 simple numbers. It's much easier than 1-800-273-TALK or spelling out the numbers for TALK. I like it already for the simplicity of it. You can also text us either at 988 or the local Sacramento number if you're in Sacramento. There's 2 ways you can chat with us: through our local WellSpace Health link or through the national 988/Lifeline link that I provided here on this slide. If you or someone you know is interested in volunteering, we would love to have volunteers. We certainly need them, and you can contact our business line about that, or any questions that you might have about business-related matters. You can also go to, I think it's on this next page. Why don't you go ahead and slide forward? Oh, it's not. This is the other deck. There's a website, California, let me peek really quick, 988california.org. And if you go to that website, it gives you a lot of background information about the implementation of 988 and how it started a couple of years ago, and where we're at now with rollout and implementation. And there's links to toolkits that you can use to help promote. There's little social media icons, like some of them I've had in my slides here. They have some for Instagram, Twitter, Instagram, and Facebook, as well as printable social media images and icons. They have videos, little short clips of videos that you can use in either social media or websites to help promote 988 in California. And those are available at SAMHSA I think it's samhsa.org. If you just type in 988 toolkit, it'll come right up. And I think that's it about 988. I do want to, say we've been really blessed in California with some great funding, thanks to our state, thanks to DHCS, thanks to J.D. Hirsch Mental Health Services being the fiscal agent for our whole network in California of crisis centers. There's 13 of us. And right now, as we speak, if you're not aware, there's a bill, AB 988, that is waiting on the governor's desk for signature. I think it'd be just divine if Suicide Prevention Week was the week that that's signed. That would be great, but we shall see. But we're all waiting with bated breath to hear that. So far, it's had zero opposition this round. And we're very hopeful that it's going to be passed. And that'll provide an ongoing, very small 18-cent surcharge on phone bills, similar to 988, the surcharge for that, but that I think, similar to 911, but that surcharge, I believe, is like 30 cents. And ours is much smaller. But that's also going to provide ongoing funding. The funding we have so far is short term to help with building up capacity. But AB 988, among other things, is going to help to provide the ongoing funding for crisis centers. That's so needed to keep our doors open and counselors staffed up so we can meet the needs of all the individuals who need our support. That's it for me. Any questions?
Thank you so much, Lisa. And that was a lot of information. So appreciate the full walkthrough of the program. That was, I can say personally, very helpful. A lot of things to think about. I do see we have one question in our Q&A. It's P. Lafayette. Oh, sorry, Pete, if I butchered your last name, but I think the question is how much emphasis for prevention by listening or inquiring from the primary subject considering their own suicide? I think what he's asking is, for people who are calling in, how much emphasis or on that prevention are you getting from people with who have been through it before to help design the prevention programs? Pete, feel free to let us know if I didn't get that correct.
We a lot of our volunteers, staff, and crisis counselors, as well as the people on chat and text, have some kind of lived experience. It's not a requirement, but many of them do. We don't self-disclose on the phone. That's just not our practice, but everybody, for the most part, people share that they have some kind of lived experience that propels them into helping others that are in crisis. And then a lot of the resources that we provide actually had, like I'm thinking of, we have a 30-day phone follow-up program for survivors, but also for survivors of suicide loss, but also for attempt survivors. And one of the resources that we hand out to the clients that come into this ED follow-up program, they get after an attempt brochure that was written specifically by attempt survivors and some experts in the field, and provide some peer-led advice about what helps, what it felt like to be in the hospital, and what it felt like to go home, and then drawing out from the person who just experienced this crisis, what their thoughts are on it. So I think across the board, we're really careful to include people with lived experience.
Lisa, I was wondering myself, even as you were talking, or as you've been talking, and as things are developing, specific to the justice-involved population, we have folks who kind of maybe are involved at the local level with jails or coming out of prisons. Are there any particular efforts underway to really support our our community members who are transitioning back? Just because that can be a really vulnerable time for for them. And so just making sure that, especially as things have changed, and this is a pretty big change, just making sure that they're aware of these resources and know how to access them. Just didn't know if anybody's been having that in conversations, and if not, what would be a good way to make sure that that perspective is represented to help build out the system.
Yeah, thanks. One of the things that we did along the process in our planning and implementation grant for I think it's the last 2 years, we had a small stipend from SAMHSA to create a stakeholder group and create a statewide plan for 988 in California. And we tried to gather as many stakeholders as we could and be as inclusive as we could. And I do believe there was some representation there on the stakeholders group, but we're always open. So I would say Dee Dee Hirsch is the lead on 988. So if you really feel strongly and want to advocate for certain groups that you feel are underserved, and making sure that their voices are heard and that they know all about 988 and how can we make that connection even better, or create it where it doesn't exist very much, then probably either contact myself or Dee Dee Hirsch Mental Health Services would be the other one. Sherry Sinwelski is the lead on 988 down there. I can share her email address as well, because we can't possibly have too much. Suicide prevention is my viewpoint on it. And we know from experience just on the hotlines, I'm close to 20 years in this work, and have talked to many people who were facing incarceration, just did something, and were facing an arrest, or broke their violated their probation. As that can mean life or death to them. The thought of going back or facing any kind of imprisonment for the first time even can be terrifying and devastating to their life and their relationships, and worth, in their eyes, dying over. But we don't have the service in the actual jail systems, but anybody who's outside of that system can certainly use our services, whether it's the hotlines or chat or text. The only times, like I said, the only times that we end up involving law enforcement is when there's a mandate to, and the person's not able to keep safe from suicide. And the majority of those are a suicide in progress. And that's one of those myths too that's out there. It just came across my head, but people think, am I going to get arrested? It's one of the myths. If I call the hotline, or if I text or chat, are you going to call the police? Or are they going to arrest me? And while in California, it's not, you're not going to jail for being suicidal, there is a risk. People feel that risk because they don't want to be involved with law enforcement. And any contact, even if it's life-saving with law enforcement, feels really intimidating and terrifying to them. So it really is, one of the things that we prioritize the most, is keeping that person safe, but right where they're at, with less intrusive means than emergency departments or police departments, or breaking confidentiality. And the vast majority of contacts were able to do that and provide support. They start to feel better. They start to see their own reasons for living. They look for what they can get through the next couple of hours or the next couple of days. And sometimes it is like that. We can't change the consequences of maybe whatever has happened in their life, whatever they've done or not done. And we can't change those things, but they can change how they react to it and how they respond. And sometimes it's just hour by hour, getting through that intense feeling like I have to do something, or I can't take this feeling anymore. And just something as simple as talking to a crisis counselor on a hotline or through chat and text really can make a giant difference and help that person at least see their own reason for not harming themselves that day, And then sometimes that's all it is needed, and they don't feel that way again, ever, or they don't feel that way for a long time. And that includes people who are, facing incarceration. But I know there are others who, never reach out or never get that support and do go on to end their lives. It's a really hard situation.
Thank you. Another question we had coming up, Shawnee Ellington, are services also educational in purpose or just primarily for those who have a knowledge set of lived experience or people with lived experiences of suicidal ideation or extreme crisis?
By services, we do community outreach. Is that what you're wondering?
I don't know. It's Shawnee. I was gonna say Paige or Emily, maybe Shawnee, if you're willing to come off mute and maybe just ask the question, because it looks like there's another question that you posed. And I would say for folks who want to ask questions, you could raise your hand as well, which should be at the bottom of your screen. Is Shawnee off mute?
And one of the other things I'll throw in while we're waiting on that one, when you reach out to 988 to text or to chat, there's actually this safe space that it gives you the option if there is a wait. We're hearing really great things about our answer rates, like dramatically. Well, our answer rate's always been high, but the national answer rate not as much. And it's gone way up. And so there's hardly wait times, but they created something called Safe Space. And it's a website that's offered in the chat right on people's either computer or cell phone as part of the process, that while you're waiting to talk to the counselor, that you can use a safe space, and it has different coping skills and messages of hope, and the Lifeline is really good about involving attempt survivors and those with lived experience all throughout the process, including with Safe Space.
Great. So Shawnee, it looks like you're off of mute now. Would you like to?
Yes, can you hear me okay?
Sure can, thank you. And thanks for being willing to come off mute to
Excellent, no worries. It just took me a second to figure it out. I haven't been on Zoom in a little while, so.
No worries.
Yes, okay. So my question was basically, can you call 988 for educational purposes? Like, I've had some recent experiences with mental health consumer around my own illness. And so I don't know whether or not there's platforms for people to learn more about suicidal ideations separate from actually working as a volunteer or an employee. And it kind of leads into the second question that I had in regards to education on means of de-stressing people who are actually volunteering for the agencies or the agency that is represented today.
So
thank you also for allowing me to ask a question.
It helps clarify. I will say we do, like at WellSpace, we have, and I think this is pretty standard for most of the crisis centers, but of course I can only speak for ours. We do have an employee assistance program that offers 6 free counseling sessions for any staff or volunteers who need support, and it's free and confidential and anonymous. And then we also have a 24-hour consultation and debriefing number that they can call anytime, 24 hours a day, even on holiday weekends. I think the other night I had four different calls. Wasn't a rush like anything terrible happened, just 4 different calls where people needed extra support. We do that intentionally, one on high risk calls, because we want to make sure there's 2 sets of eyes on those calls, to make sure we're doing everything right and make sure all the boxes are checked and the person's getting the best care possible. but also because occasionally, not frequently, but occasionally, we're humans, and occasionally those calls might be stressful for the call taker or
Exactly.
the chat counselor, because we're human beings too. And so if that happens, they still, same thing, they can unplug for a while, they can contact a supervisor through this on-call number. We even have a sitting area at my crisis center that has a big couch and sofa and this basket on a glass table that's full of like self-care books and essential oils and all these self-soothing things, green plants, and people. I see people going out there all the time on their meal breaks or their rest breaks, and they'll bring a blanket and go lay on the couch, not to nap or anything, but just to just really take care of themselves and nurture themselves. But most of our team, it's one of those things that whenever we're interviewing people to come in, they say, "Oh, what about, is it stressful?" And that was my worry when I came on as a volunteer many moons ago. Is it really stressful? I really want to do this, but I don't want to mess it up. And it's much more rewarding than it ever is stressful. Like, there are some times where it's scary and the situation's hard or precarious. But in there, we've had so much training that we just kind of go into our training mode. And then we always have somebody to talk to later. And but the vast majority of calls, people feel so much better. They express that during the call or the chat. They leave comments, in the surveys that we have in all 3 venues. And just the fact of knowing that you saved somebody's life that day or made a life-changing difference in their life is so rewarding that it far overshadows anything that might be stressful. I hope that answers your question.
It does. Thank you so much. Again, if you could repeat what you said briefly in the beginning about six sessions.
Oh, the Employee Assistance Program.
Okay.
Yeah, that's offered at many agencies, larger agencies usually. It can include mental health counseling. It can include a lot of things, legal assistance. It just depends on the agency what they include or not in their employee assistance program.
I appreciate it. Take care.
Mm-hmm.
Thank you.
God bless you.
I think, thanks, Shawnee. Appreciate it. Thanks for engaging in the conversation. So it looks like next up we have Arden Tucker, and I see Arden, you raised your hand, so we'll just unmute you. And if you want to ask the question that you put in the Q&A, if there's anything else you want, please go ahead.
This is me. So I just wanted to ask about are you able at all, or do you provide resources, any resources for attempt survivors? The only thing I have found in California is in Southern California with DD Hirsch.
Yeah, they started that a few years back, and Sherry Sinwilski, who's now the vice president over the 988 program at DD Hirsch Mental Health Services. She used to be the vice president at the National Lifeline, and she just went back to work at DD Hirsch. And she was one of the people that helped create the Attempt Survivor program there as a pilot. And they have done some trainings. I don't know which ones are still continuing in California. I know there was one in the Bay Area. I can try to look those up and share those links with Brenda. And there's also Live Through This is one of my most favorite Attempt Survivor websites. You might check that out. I think it's livethroughthis.org. And an Attempt Survivor, who's also a photojournalist, created that website, and she tells the stories. Well, she has people tell their own story, and she has a sit-down session with them, and then after they talk together, then she takes a really close-up image of them, and they're just some of the most beautiful pictures of people from all walks of life really really takes a lot of the stigma away, and you hear a lot of stories. You can read about a lot of stories of triumph and people going on to live, very healthy, happy, productive lives beyond their suicide attempt. So that's another resource that we share oftentimes with people. But as far as local groups, no, not in Sacramento. But we do send materials out to attempt survivors as well as suicide loss survivors. And livethroughthis.org and D.D. Hirsch are probably the places that I would point you.
So really there really is almost nothing.
There's not a lot, but there are other centers. I'm not very familiar with which ones have had the training. It's extensive training for the people that lead and facilitate those groups, because it's a really high risk group. And most of them have the program itself, I believe, requires a clinician as well as a facilitator. So you can certainly contact D.D. Hirsch and see of all the people that they've trained, which ones are still open. They might be able to help you with that.
Okay, thank you. I don't know if there's other people waiting to ask a question. I just inquisitive about I completely understand it and have heard of it before. The percentage of white male, I believe, is it middle-aged, suicide rate that is very high. I'm wondering how the percentage of men have been researched / compiled. How are men of color included in that research, and does it include suicide by cop?
I can say there is quite a bit of literature out there about racial differences in suicide deaths and attempts, and suicide by cop. I don't have those at the top of my head to share with our group, but I do know that there's a lot of interest as well as studies that have been done in those areas.
I was going to say too, we try to put out as much information. We have a website, a dedicated page on our website where we try to gather as many resources as possible. So I'm thinking, Arden, the CDPH, the California Department of Public Health, has a lot of stats that they put out, and I believe we have all. Monica Page, do we have CDPHs on our website? I was going to say to my team, if you guys can drop into the chat, or if we can make it available later, the link to all of our resources for everybody joining today, so that everyone knows where that landing page is. And then Lisa Ann, if you have those links that you were thinking to send my way, if you wouldn't mind just sending it, and then I'll get it to the team. We'll get those links onto that website for us as well. Oh, looks, she's already doing it.
Yeah.
So
Yeah,
if my team can get that onto the web page and then get the web linked out to everybody joining us today, I think that would be, just that we can at least get some of those resources out, and maybe that'll take people down the road to clicking on different links to find the answers that they need or that they're looking for. So hopefully that's a little helpful. I was going to say, looks like I think Pete had his hand raised, our last one, and I know we have just a couple minutes left, so let's try to squeeze them in. Pete, thank you for joining us.
Okay, if you can hear me all right. Let's give a hypothetical. If I'm a primary person considering my own suicide, I have not, there are not enough hours in the day to explain to somebody all the trauma I've lived through in my life, starting with the JFK assassination, then Martin Luther King, then RFK, then the Vietnam War, then the 90s, then Central America, all the way up to 9/11 in the 21st century. And that's not even counting the 21st century, not all we're experiencing now. As I asked earlier, do you think there's enough emphasis on allowing people to address and cycle through all their personal trauma that's driving them to suicide?
In the crisis call, usually when people are calling, much of their life experience, suicide is rarely just one particular trigger. It can often be a whole lifetime of pain and trauma and painful experiences. And our staff are keenly aware of just how much that's true. And some groups and populations even more so than others. And I like to say we have a pretty sensitive and empathetic group. When somebody calls us and they're in a suicidal crisis, typically there's something that triggered them, and that's what they're wanting to talk about. And there's like either a presenting issue or a presenting feeling or both. And that's what we focus on, because that's what we have control over in a single conversation with somebody. And our whole focus is on concentrating on keeping them alive for the night. And so we'll unpack as much as we can unpack in a single conversation. Some of our calls go as long as an hour, and people reveal a lot of things in their lives, things they've never told anyone, things that have fallen on deaf ears in their experience. And whether that's from a system or from individuals that are supposed to care for them. And part of that can be some really awful historical trauma. But what we do focus on primarily, in the context of a crisis call, is whatever the presenting issue is or the presenting feeling or feelings, because that's what's pressing most on them wanting to live or die, and also addressing some of the fears that come up from some of those lived experiences too, because somebody even mentioning let me send some help to you can be terrifying to somebody who has been exposed to some of the really negative things that happen when law enforcement come out with a mental health intervention and things go bad. So our teams carry some of that burden, as far as they don't want to send people out, unless it's really mandatory that they do, for many of those reasons. So they're really cautious about it, but also they're very aware that the people we're talking to might have had some really terrible experiences that make them distrust all helpers, all caregivers. So
thanks for your efforts today. Thanks so much.
Yeah.
Thank you, Pete, for clarifying the question that you asked, so that Lisanne could answer it really fully. So, and thanks, Lisanne. So I know we're at 1 after. Thank you so much, Lisanne, for taking us through everything, taking the time to spend with us today, and answering questions for all of us, and really to you and your team for all the great work that you're doing out there to help those who are in crisis, and really helping to build out our crisis system. So the everyday, but also the larger vision. And then also a big thank you to our participants again today for spending time with us, and really helping to think through all of this and just really spread this information out as widely as possible, so that folks can be in the know and have access to these resources when needed. So just a few announcements we're going to continue on for our month's activities. In addition to suicide prevention awareness, it's also substance use disorder recovery awareness month. So we have activities lined up for our lunch and learns as well. Oh, and CDPH also. Yes, thanks, Lisanne. And then we also have our 2 spin-off work groups. So we have our CCJBH full council that meets quarterly, and we have our 2 work groups, our juvenile justice work group and our diversion and reentry work group that meets every other month. The work group meetings will be held on September 30th. We'll be looking through our legislative report recommendations. As many of you may, or some of you might not know, that we have we're mandated, CCJBH is mandated to produce an annual legislative report by December 31st of every year. So we're looking to finish up those recommendations and get those routed. And then our full council meeting will be on October 28th from 2 to 4:30. All of these are virtual activities, virtual meetings, and our full council meeting will focus on housing. So housing is a huge issue. So we'll be able to talk about housing and get an update from the California Interagency Council on Homelessness. And then also the Los Angeles Regional Reentry Partnership will be talking to us and really explaining to us their model of how they've built out housing in a very innovative way for the reentry population. And as always, we have our listserv. We really want to invite folks to join our listserv. If this is your first time joining us today, we hope you found this informative and informational, and would love to have you continue tracking our work. And for those of you who are already on our listserv, we hope you find the information we produce and send out every Friday to be really helpful, and let us know if there's any way you think we can improve. So with that, thank you so much, everybody, for your time and attention today, and the great work you're all doing to really strengthen our communities out there, to really support our population in general, but just also the larger California population. All right, well, thanks so much. Thanks to my team for a great job in helping coordinate the webinar, and we'll look forward to seeing everybody again soon. Take care.